Okay, the next disease that I'd like to talk about is sleeping sickness. Now, sleeping sickness is a vector disease, and the vector for sleeping sickness is the TT fly. And sleeping sickness is not pandemic by any means. It is only found in Central Africa. But what sleeping sickness is essentially a condition where a parasite, this is a parasitic disease, enters your system and it begins attacking your lymphatic system. And your lymphatic system is the system of your body that cleanses out all of your toxins. So it begins to compromise your body's way of getting rid of toxins, and those toxins begin to build up in your system. Your lymph nodes begin to swell as well. And then over time, when the disease crosses over the blood brain barrier, it starts attacking your brain. And your brain will begin to swell. It essentially begins to eat away at your brain, putting you in a comatose like state, hence the name sleeping sickness. And children are particularly susceptible since tsetse flies like to hang out near the water and children like to play in the water. Now, there's a huge controversy associated with sleeping sickness, and it brings up kind of an ethical question regarding the responsibility of drug companies. There was a drug company that was testing a particular drug for cancer. It wasn't very effective for cancer, but they discovered that it was effective for sleeping sickness. The issue, however, was that the countries that have sleeping sickness could not necessarily afford the drug. So, did the company want to invest a lot of money into research and development for this treatment that countries would not be able to afford to actually buy? And they ended up shelving it and not doing further research on it. They found out by accident, which is how a lot of things happen in the drug world, that it also removed hair. I don't know how that happened. I don't know if someone dropped it on themselves or whatever, but they found out that it removed hair. And then eventually it became the primary active ingredient in a drug, in a cream, essentially, to remove unwanted hair, particularly unwanted facial hair. And this is where the controversy came in, because then now they dumped a lot of money into research and development, into advertising, and the drug was being used not to help the children of Central Africa who were having their brains eaten, essentially, but it was helping the millions of women in the developed world afflicted with unwanted facial hair. So you can get a sense that there would be some controversy there. And it did bring up a controversy, and the drug company did eventually agree to send a certain amount of the drug to Central Africa. The problem is, with sleeping sickness, it's not a one-time deal. You need multiple infusions of medication. So I don't really know what the update is on this, because that drug company has since been acquired by another drug company. I'm sure you can find information on it online. But it does bring up the question of what is the responsibility of the drug company? And is there something that they can do to help, yet not necessarily lose a lot of money? Because one can probably understand, if you're spending millions of dollars on research and development, that you want a return on that. On the other hand, if they discovered a cure for a disease that kills lots of people, is there an ethical responsibility to address that? So some have suggested perhaps they could take a certain percentage of proceeds from the facial hair cream and donate it. You know, people have all different sorts of ideas regarding this, but it does kind of bring up that question regarding ethics and drug companies. Because in many cases, what it comes down to is just the availability of essential drugs. And literally millions of people die because of a lack of safe and inexpensive drugs. Safe is a big one because there's a huge black market for drugs and there's a huge knockoff market for drugs. It's not just handbags and sunglasses that are knocked off, but there are lots of drugs, particularly for diseases that are common in the developing world, like malaria, that are knocked off and are put on the market, and the packaging looks the same, the pills look the same, and who knows what is actually in those pills. The safety testing is more or less non-existent in many parts of the world, so that's an issue. Plus, it's expensive. So it's expensive not only at the individual level, but also the country level. So can the country even get the drugs? And then when that filters down to the individual, what will that look like in terms of costs? And then you have the compliance issue that we talked about earlier. If they have the drugs, will they know how to use them? In many cases, you're just given a bag of drugs, and that's it. When we go to the pharmacy, we'll get the prescription drug. We'll get all types of stickers to tell us how to use the drug. We'll get a multiple-page pamphlet stapled to our receipt that tells us every single thing about the drug. Then they'll ask us, "Well, do you want to talk to the pharmacist to make sure you know how to use the drug?" I mean, they can't really do more to ensure that we know how to use the drug. However, in other parts of the world, you're just given a bag of drugs with oral instruction. So how do we improve that? We learned through a malaria intervention program that blister packs, for instance, increase compliance. And if you're not sure what a blister pack is, it's you see it a lot with over-the-counter medications, cold medications, but even prescription medications come packaged this way, where they're in almost like little plastic bubbles, and you have to push the pill through the other side. That's a blister pack. And what that does is it protects it. It protects the drug, so you're not just going to take a pile of pills and put them in your pocket. It protects it. But in many cases, it also provides a dosage as well. So you can tear off a dosage. So not only are they protecting the drug, but they have the dosage. So they don't have to remember, I have to take 2 of this pill or 3 of this pill, and they have a way to protect it. Of course, the issue with blister packs is that they're more expensive. So whenever you get into better packaging, you're looking at a higher cost. So there's a trade-off there. But they no doubt help with compliance. Okay, HIV/AIDS is the last disease that we're going to talk about in this section. If you're interested in medical geography, I do teach a whole course on medical geography that's offered at an upper division level. Many people other than majors also take it, so not only majors that are interested in medical geography, but also health science majors as well, or even biology majors, or I have students across the board that take that class as an elective. So HIV/AIDS, about 90% of people that are infected are in developing countries. So by and large, we have the highest rates in that part of the world. Those countries that are considered developing countries, less developed countries. About 9 out of 10 do not know that they are infected. Because again, in order to know you're infected, you have to be tested. So are they going to be tested? The highest rates are in Africa, but rates are growing quickly in other developing countries. So for the longest time, the rates were highest in Africa, highest in East Africa, which we're going to talk about in a minute, but then Southern Africa now. But we are seeing higher rates continuing to increase in other parts of the world. We know that education plays a huge role, probably the biggest role, in reducing AIDS rates. This is looking at sex education and HIV prevalence in Uganda. We're going to talk more about Uganda specifically in a minute. And you can see over the course of just a few years that introducing HIV/AIDS education dramatically decreases the AIDS rates. So we're going to talk a little bit about AIDS in East Africa, and we're going to focus on Uganda. And I want to preface this by saying that what I'm going to talk about here is based off of my own research and the research of the team I was with. It is not necessarily reflective of all of Africa and certainly not all of the world. What is reflective of our particular sample that we looked at in Uganda. And we chose to study Uganda because Uganda at one time had very high rates. And the high rates were falling in Uganda. So we wanted to know why. And Uganda now serves as a model for other less developed countries. So remember that there were high rates, but the rates have fallen. Okay, the rates have fallen dramatically. That will be on the exam, and all of this will be on the exam. And most people tend to reverse the two because they instinctively think, oh, Uganda, Africa, rates must be increasing. But we found that they were decreasing for many reasons, and one was the AIDS Support Organization, otherwise known as TASO. This is a nonprofit organization that was started by a woman that was involved in AIDS prevention. Her husband had AIDS and died of AIDS, and she started this organization to educate people who have AIDS, who have relatives that have AIDS, or who think they might have AIDS. And there are several locations all over Uganda. And we noticed that there were clear diffusion patterns that were linked with TASO centers. So, of course, with medical geography, we do a lot of mapping. So if we mapped AIDS rates across the country, and then we overlaid that with maps of where the TASO centers were located, we noticed that within a certain radius of each center, there were lower AIDS rates. So we wanted to know what TASO was doing. In addition to TASO, there was a lot of government support. There needs to be a willingness to discuss the issue, not only at the individual level, but at the government level as well. And there were large-scale government campaigns. So it's really, really hard, particularly in a less developed country, to get a grassroots movement off the ground without cooperation of the government. It's also really difficult to address a problem if you're not willing to discuss it. And AIDS can be tricky because there's a stigma attached to it. And to talk about AIDS means that you're going to have to talk about sensitive issues. You're going to have to talk about sexual behavior. And people don't want to talk about that stuff. But they realized in Uganda that you have to be open to it. You have to be frank and candid about sexual behavior in order to address the problem. So we as a team had a privilege of doing several interviews in Uganda with those that had been affected, and to shadow counseling sessions at the TASO Center. And we were given access to all of their client files, which is unheard of in a developed country. You can't go to a hospital in the United States and say, oh, I'd like to see the medical files of all your AIDS patients. But they gave us access to that in exchange for our results. So we got lots of very rich data on cultural issues, on employment issues, religious issues, all types of demographic information, and we could track clients over time to see how effective their program was. But I also want to talk about some things that came out of the research, particularly those involving culture. As I said, just about every topic that we talk about is going to connect to culture in some way. So in the next segment, we're going to talk about culture and AIDS in Uganda.